Good afternoon. Welcome one. Welcome all 550 plus registered. My name is Daniele Zanotti, CEO at United Way Greater Toronto, with our IT tech friends who have welcomed you from the waiting room, framed us all together like the opening of the Brady Bunch. Remember the Brady Bunch? I know some of you don't even know what the heck the Brady Bunch is. It kind of started like a Zoom meeting of squares. Anyway, with Adriana, who will moderate any questions that you send, and please do, to webinars@uwgt.org. With you, our donors, volunteers, frontline agency staff, partners, friends, moms and dads too. Thank you all for gifting your time to this fourth webinar now in a series from the front lines of our network of agencies. Now, those of you that have been with us before know of my daily walk to the river. Now scheduled walk and talk meetings with staff or maybe even one of you. And I always apologize in advance for all the background wind tunnels, for all the speeding, souped up Hondas roaring along Highway 7, for one of my neighbors in the background yelling out, "Hey, buongiorno," and me signaling. So last week, I'm sitting on a tree stump where the Humber River meets Clarence Road, grateful for the indigenous land where the Haudenosaunee, Huron-Wendat, generations of others too, farmed, fished, hunted, hoped, imagined, and reimagined this place that we love. And I pulled out my phone and read an article. The headline was, and I quote, "Scientists dug into the connection between income, gender, race, housing, and COVID. And what they found was alarming." And they reference my new scarfed superhero. I watch her every day, same time, same CP24 channel, Dr. Eileen de Villa, Toronto's Medical Officer of Health. And in the article, she notes, data suggests that COVID-19 may impact some groups more than others. The homeless, women, indigenous, people living in lower income neighborhoods. That neighborhoods with a high proportion of recent immigrants, areas with high unemployment rates, also had higher rates of COVID-19 cases and hospitalizations. Nothing alarming here, friends. Not for public health, not for United Way, not for any of you that have been with us, with United Way, with community. Think about our poverty by postal code report decades ago now, showing that poverty was sticky and stubborn in our 416 suburbs. And then our opportunity equation report, giving this GTA the dubious distinction of the income inequality, child poverty, and housing unaffordability capital of Canada, showing that a majority of all neighborhoods in the GTA are now either high or low income, and those middle income Brady Bunch neighborhoods vanishing. And these pockets of poverty are spreading into York region, and most dramatically into Peel too. And then last year, a follow-up United Way report validating that poverty was hitting some, youth, women, immigrants, racialized groups, harder, deeper, longer. Nothing alarming here then, when data suggests that COVID is disproportionately hitting our most vulnerable. as he presses the elevator button at 4:15 a.m. on the 23rd floor of the building to go to his temporary construction job, and then finally comes home at 9:30 p.m. after the last food delivery from his second job. As she kisses her 3 sleeping kids in their 1-bedroom apartment, locks the door, and sprints to catch the 5 a.m. Finch bus to take her to her PSW job at a nursing home in Mississauga. As he moves from shelter to tent to park, and smiles when he opens this care package prepared and delivered from Toronto Aboriginal Support Services Council, thanks to United Way donors like you. So I stare at the water of the Humber River as it rushes downstream. And I think about the last few months. Think about it, your last few months. All of us immersed in immediate interventions, as we should be. Food, supports for our most isolated. It's the hierarchy of needs. But the real risk is of drowning in the now, of getting swept downstream when COVID is magnifying, amplifying, screaming upstream problems. Housing, good jobs, income, access to supports close to home. And buried in the middle of that article that I'm reading on my phone is one line that I read and reread every day since. To get ahead of this, and I quote, "We must collaborate with communities to support the development of preventative strategies by the community for the community," end of quote. This is where we have to start. If we want to reimagine care, social services, community, this is where we are going to start today. For this next hour, we're going to look behind that headline. Scientists dug into the connection between income, gender, race, housing, and COVID. And what they found was alarming. We will talk of immediate emergency interventions, the work that you make possible as donors, volunteers, frontline staff of our network of over 270 agencies across Peel, Toronto, and York. And then we are going to push our panelists to go upstream too, to help us reimagine how do we name, claim, and solve for the root causes, and do so with and by and for community. What an hour. Our panelists, Michelle Bilek, founder and co-chair of Peel Alliance to End Homelessness, Deepa Mathu, executive director of the Barbara Schleifer Commemorative Clinic, and Dr. Jeff Schiffer, executive director of Native Child and Family Services of Toronto. Unfortunately, Colleen Zakur, executive director, Community Living Central York, is not able to join. A last-minute health emergency. We wish her speedy recovery and have promised to get her smiley face and sweet, sweet soul on a subsequent webinar. Get well, friend. So let's get started. And please start sending questions to webinars@uwgt.org. And then by about 3:30 or thereabouts, we will take your questions that Adriana will flow over to me. Michelle, over to you, my friend. Tell us what brings you into the work of the Peel Alliance to End Homelessness, and what the impact of COVID has been on individuals experiencing homelessness in Peel.
Well, thank you, Daniele, and I want to also thank the United Way of Greater Toronto for inviting me today. The Peel Alliance to End Homelessness is a collective effort from agencies and leaders across the region of Peel, all working together to end homelessness. And the Peel Alliance to End Homelessness was formed after just a group of local frontline staff and programs and advocates dedicated themselves to embark on the region of Peel's first ever registry week, which was a homelessness enumeration in 2015. The Canadian Alliance to End Homelessness launched its 20,000 Homes campaign, which did support communities to participate in these registry week enumerations. And it was I, and again, other homelessness leaders in Peel, and that decided that we would attempt to do so also in Peel. With the support and endorsement of the Peel Poverty Reduction Strategy Committee, to which Anita Stalinga of the United Way of Greater Toronto is co-chair actually. We planned and executed this homelessness enumeration over a 3-day period. The United Way funded and provided leadership with this work, and the result was the creation of a by name list. A list of individuals experiencing homelessness in Peel. And by using a common assessment tool, this list actually prioritizes people based on their needs. And because homelessness is a systemic problem involving various agencies and sectors, its policies and service provision needs to be delivered as part of sort of an integrated systems response. And the Peel Alliance to End Homelessness aims to support systems integration by introducing what we call a coordinated system of care, also known as coordinated access for homeless services. A system of care is community-based, with services resting within a supportive, adaptive relationship at the community level. And it's client-centered, it's community-based, all for those people experiencing homelessness in our region. The Peel Alliance to End Homelessness also works to promote a cross-system collaboration of its members, collaboration with the region of Peel, establishes linkages between services. We share and promote all of our best practices together. And we believe that by aligning services, we can avoid duplication, improve information sharing, increase efficiency, and provide a more seamless experience for individuals and families experiencing homelessness in Peel. As the coronavirus began to spread though, of course, all of our sort of programs and advocacy and the work that we were doing at the region of Peel did change. We know that unhoused people are among our most vulnerable to the infection. And as we've seen, it's our most vulnerable, are socially and economically marginalized, that are being most impacted by this crisis. Unhoused people are already among the most ill and physically vulnerable in our society. They have no means to stay home or self-isolate, let alone being able to socially distance themselves from each other. They no longer have access to meal programs, services, or public spaces, including washrooms. Those in shelters needed to distance themselves. And shelters and homelessness services here in the region of Peel needed to act obviously quickly to implement isolation and safety protocols right away. At the Canadian Alliance to End Homelessness, which I work for, we worked hard to bring all of these needs, whether it was personal protective equipment or funding siphoned down to communities, to be at the forefront of the initial funding rollout by the federal government. Here locally, the Peel Alliance to End Homelessness and the region of Peel worked closely together to support the creation and implementation of a response plan that included reducing shelter capacity to our most vulnerable by 50%, so that we could have physical distancing protocols in place. The region obtained hotel spaces for shelter stayers so that they could distance and isolate themselves. And those with symptoms would receive medical supports and isolation program site. And those who actually tested positive did receive medical support, and we still have an ongoing isolation program here. The financial resources from our levels of government have helped to pay for these ongoing measures. And I really do believe that the proactive leadership here locally and on the ground has saved hundreds of lives and avoided outbreaks so far here in the region of Peel. But the discussions now that the Peel Alliance to End Homelessness is having with the region of Peel leadership is around the what next. So we're thinking about more of a housing response to COVID. Right. We want the region to think strategically and thoughtfully on how we now move forward and get people permanently housed from shelters or hotels. We also don't want to return to an as normal as usual, or the normal response to homelessness, which means living in shelters. Now we really do believe it's a time for us to realize that business as usual doesn't work, especially for our most vulnerable and marginalized in society. It's time for a social and economic revolution. And the Peel Alliance to End Homelessness wants to be part of that here in Peel.
Michelle, I was going to ask you another question, but you swooped beautifully into what might we need to do to reimagine this post-COVID, and so eloquently speaking about the need for housing and taking this as an opportunity to, dare I quote, revolutionize how we care for the unhoused. Peel, in fact, has been cited as an example of a best practice in how you move this forward. But let's not forget, so much of this based on the foundation that you have built with partners, people with lived experience, agencies, government for years before, and the importance of that as we move forward. Thanks so much, Michelle. I want to pivot to Deepa and speak to you a little bit, Deepa, about worrisome stats and trends that are emerging, the silence and scariness of what some are suggesting is a 30% increase in gender-based violence calls across postal codes. And others are simply petrified that that's way too low and there must be women, people suffering in silence. We've heard a story of a group of women in a cluster of apartment buildings who have developed their own little SOS system. A towel folded on the balcony means I need help. Tell us about the work at the clinic and the impact of COVID you're seeing on the people you work with.
Thank you, Danielle, and thank you again for inviting me to speak today with this large group of people and organizing this. At the clinic, I'll go a little bit back from the time pre-COVID-19 time. So I just want to share a stats with all of you that in terms of the violence against women, and specifically intimate partner violence that we all know is the most common and widely spread form of violence, we say that the stats available tells us that less than 40% of the women who actually experience violence seek help. And most of them who seek help first turn to their friends and family. So that's a pre-COVID scenario stats that we all have available. Right at the onset of the announcement that women, we all should be staying home, my first knee-jerk reaction that I had to that announcement was that, but for some people, home is not the safe place. Some people don't have a home where they live. It is where they live. So knowing those two facts, the reality of women who are stuck in isolated situation with their abusers, definitely the violence which we are seeing and the increase that we are seeing is just tip of an iceberg from what my assessment. So that 30% increase is only the beginning of what we will actually see as a surge that will come to us as things start opening up a little bit, and as we see that aftermath of the post-COVID-19 impact. So the impact on the clinic's work overall, I can tell you, is that we are seeing way many more high-risk cases as compared to what we were seeing before. So a lot of women who are reaching out when things are really bad. And when I'm saying high risk, I'm giving you indicators of, you're talking about weapons, you're talking about threat to life, you're talking about threat to life to their children and pets, you're talking about restriction on their movement and cyber violence. So those are the high risk factors that we are looking at right now in our caseload and in our work. And the wraparound service and a trauma-informed service that the clinic really practices is hard in this isolation, because we don't have the same wraparound model that we can actually provide them without having the capacity to even be in touch with them at times. Mm-hmm. So that's the biggest challenge, that how do you provide a connection to reduce that isolation when you know that that connection sometimes is also harmful, because she is being watched, she is under surveillance. So similar to what you just suggested, that in our building, people, women have come together and they have created this towel safety indicator. There are lots of other safety tips that are being developed since COVID-19 has come into our lives. There is a lot of don't miss a chance rule that we have developed around our practice. We make sure that if a woman connects with us, we take that as one chance rule, and we make sure that we develop a protocol around code language to stay connected with her, make sure that the resources that she needs, if she can't come to us, we will get those resources to her somehow. And those resources include right from food voucher to creating an exit plan for her to leave, to making sure that we collaborate with resources and other organizations which can provide support. We were very fortunate to get some private donations of phones and tablets to make sure that women were actually connected with the resources that we could put out towards them, and create a virtual platform of ongoing services. So that's the impact that we are seeing, and those are some of the solutions that we have come up with.
I know that we at United Way have also helped with funding of laptops to enable some of this remote support, support as well, where you're acting as a trustee to reach out to members within the Black community as well. But let me go back to Michelle's word of revolutionize. And as you think upstream, what are areas where the clinic is keeping its eyes and ears on of things we must reimagine post-COVID to get to the deeper systemic issues of gender-based violence?
So I would say two things. So the one is, one thing that I have been saying in my conversation is that sometimes pandemics are the prisms of our society. It actually just shows us things that we have known all this while, but they were not really right at the surface. So one thing which came on the surface for all of us suddenly was that gender-based violence was slightly an afterthought at a global level. I'm not just saying us as in Ontario or Greater Toronto area did that. At a global level, when the pandemic management was started, gender-based violence and what will happen to the women in isolation was an afterthought. It came like 2 weeks behind. So definitely at a system level, I think upstreaming, thinking about planning for future is that we keep gender-based violence and violence against women at the center of every decision-making that we are going to make. We remember that women who are not served, women who are not connected are the ones who are most isolated and most marginalized. And who are they? They are racialized women. They are women who don't have access to the language. They are the women who are not connected to the community here. They are disenfranchised because of the reasons of legal implications in their lives. And women who are homeless without connection to security. So we are talking about a spectrum of population which is not underserved, because we have put a lot of emphasis on underserved for many years. I think we have to start thinking about unserved And women without immigration status is that big population. So moving forward, I think one of the things is to keep this discussion at the center, making sure any decision making keeps this in mind. And number two, that the resources are allocated where they are needed the most. So women without status who don't have access to any resource, any housing facility, we know that things can happen in a different way. We know that health opened up for the non-status folks recently. We know that housing is opening up for non-status folks recently. We are saying that they are also very much part of our society and community, and we are making that adjustments right now. Those adjustments needs to stay. So moving forward, the adjustments that we are making, they need to stay for coming years.
Deepa, what language you have given us around the prism and not underserved, but unserved, and helping us reposition our language is an important step of getting to those upstream issues. Thank you for that, Deepa. Dr. Jeff Schiffer, leading one of the countries, if not, sir, the country's largest Indigenous-led organization. Tell us about the work over the last few months and how COVID has impacted your programming and the people you serve. Jeff is talking, but he has forgotten his mute button.
Oh my God,
right,
I pulled it. So I was thanking you for inviting me here to speak to everyone and for acknowledging the territory. But I forgot to take myself off mute. So thank you for starting us in a good way, Danielle, in all seriousness. Yeah, no, I mean, so for those of you who don't know, you know, as Danielle said, Native Child is a fairly large multi-service organization. Before this hit, we had about 300 staff working across 18 locations across the GTA, delivering about 100 different programs to about 7,000 individuals a year, unique individuals, and all of that focused on the wellness of Indigenous children and families. So everything from Aboriginal Head Start programs and early on centers and daycares to children's mental health and youth services and you know, transitional housing and clinical and cultural supports. And, you know, I think the biggest thing we noticed when COVID hit was that in a very, very short time, we saw the face-to-face prevention services that Indigenous people rely on in Toronto on a daily basis recede like a wave going back into the ocean. And that happened within a context that is very significant for Indigenous people, right? Because disease and epidemics have a very, very deep history for Indigenous people across Turtle Island, across North America. And so there is a lot of intergenerational trauma, I think, that are coming up for Indigenous people. We can't also forget that COVID-19 is a virus that, you know, puts older people at risk, right? And that's also significant for Indigenous people because our elders and our knowledge keepers are very critical for cultural continuity, right? For many Indigenous communities, there's 5 or 6 or 10 language speakers remaining, and they are all incredibly susceptible to COVID-19. You know, so we pivoted, like many other organizations, to get our staff working from home and to develop a suite of digital services. But I think that one of the things we did, which was really amazing, was just look to our sibling agencies. And across Toronto, you know, the 18 Indigenous organizations that are members of the Toronto Aboriginal Support Services Council started intensifying partnerships in ways that I think are really phenomenal. And a lot of that work was made possible by donors like United Way that enabled us to create things like the Community Hamper Program, right? Like a lot of the families that we support that didn't have the means to self-isolate for 2 days or 3 days or a week or 2 weeks because they didn't have what they needed to do that. So, so we started delivering, you know, concrete supports, food, education kits, supplies, and things like that to families. But as has already been mentioned, home is not a safe place for some kids at the best of times. And without kids being in schools and without kids being in daycares, a lot of vulnerable situations were created, you know, for a lot of children and families. And so I think some of the work that we have to do ahead is around engaging our communities to think about what COVID recovery looks like. to think about how we can get families outside safely, to think about how we can get eyes on community. So we've focused a lot on supporting cultural connections virtually, and working in that way. And I do want to say that a lot of the conversation today and elsewhere around COVID is focused on innovation and how we reimagine service and forward thinking, like what is going to come out of COVID. And I do want to say that putting our attention forward is great, but in circumstances like this, it also makes a lot of sense to turn our attention backwards, because we sometimes forget that in North America for tens of thousands of years, there were indigenous cultures and societies living in very dense, complex, diverse groups, navigating all sorts of health challenges, biomedical challenges, environmental challenges, and a lot of that indigenous knowledge still exists with us today, right? When we think about the fact that when the first settlers came to Turtle Island, there was about 1,800 different languages across the continent, representing an immense diversity of indigenous people that had tens of thousands of years of history and knew how to build and live in communities in a good way and face challenges. So a lot of the work that we've been doing is, you know, what you said in the beginning with that quote is basically going back to our elders and our knowledge keepers and working with the indigenous communities, plural, because there isn't just one, across Toronto to say, how do we tap into some of those intergenerational knowledges, some of that innovative indigenous thinking that we know is going to be critical to supporting not only the indigenous community, but that will also help all Torontonians as we navigate this challenge together.
Brilliant. I love you. I love you. That the ability, so much focus on the power of AI and all of these forward, all critical, but the need to look back at what's worked and the wisdom of things that have worked. Sometimes so simple, like working with community. We can't forget that. Jeff, outside of all the pivots and work that your team is doing, what is freaking you out about the root cause stuff that we have got to get to in the Indigenous community?
So I think in terms of the short term, I'm worried about you know, schools being closed until September. I'm worried about, I've got a tiny patch of grass behind my house. My kids are outside right now running around in circles, and they have access to green space. But the reality for most Indigenous children and families in Toronto is that they don't have access to green space. And that's important for a number of reasons, not only for us to get eyes on family, but because trauma-informed land-based practice is demonstrated to lower anxiety, support mental health, and get people through difficult situations. And that doesn't just apply to Indigenous people, equity-seeking groups, humans. Humans need to be outside. So we've been doing some advocacy with the city and the province because we know that we can do that safely. I think the other thing that worries me, and this is a bit more long-term, and one thing that COVID-19 has demonstrated, I think for all of us, is our conversations about really long policy advocacy campaigns, that navigating red tape and budgetary cycles and Treasury board submissions, all of that is not necessary to make big change. We have just seen over the last 9 weeks that we can come together and make tremendous change quickly. I really hope we don't forget that, Daniele. I hope we do, as we move into recovery, I hope we don't have some kind of episodic amnesia that prevents us from forgetting what just happened. Because we know now that we can come together collectively across cultures, across sectors, across disciplines, across ministries, across levels of government to solve issues like homelessness and poverty and racism and violence against women and a lot of the things that we're talking. And so I think, what are some concrete ways that we can come together as government, as nonprofit leaders and organizations, as funders, as community members, right? As Torontonians, as people living across the geography that we're talking about, to ensure that we don't forget that we've carved out those pathways and we can continue to leverage them to create real change and achieve better outcomes for people.
I know for me, never again will I accept from our team when they say it will take us 6 months to get fully mobile at home, when in fact COVID saw us do that over a weekend. But I hope, to your point, Jeff, we have the same tenacity and courage as citizens of these places that we love in the GTA, not to accept answers like, we can never really get rid of homelessness, or we can never fully house people. because this has demonstrated we can move fast, we can collaborate, and we can do so at a systemic level. What a panel. Brilliance from Michelle around revolutionizing, Deepa's comment around the unserved, and Jeff's reminder to look back for innovation and wisdom as well. We have started to get some questions from you. Thank you, and continue sending them to webinars@UWGT. One of them that has come in picks up beautifully on the circular discussion we have had, that we are better when we collaborate, whether it's at the Peel Alliance to End Homelessness and people with lived experience and agencies and government working together, whether it's at the Barbara Schleifer Clinic with agencies from comparable sectors working collaboratively, or whether it's at Native Child through the partnership at Task, this ability for our network to act in a united way. And so the question is, now that we have this collaboration at a system level, what do each of you think about service duplication? Will we go back to days when all continue to try to do everything? Or will we try to streamline this network of agencies? Anyone have the courage to jump into that one?
Well, in the homeless sector, there's a huge movement, like I mentioned, towards coordinated access, which again is a coordinated systems approach to ending homelessness, right? And that's quite frankly about and based on collaboration, right? And bringing each agency as best to offer to the table, right? And how we're able to specialize a little bit more in what we do as a service agency, so that not everybody is doing everything, so that we do avoid duplication, right? That we're not all chasing after the same funding dollars, right? That are just because, take for example, I don't know, a landlord engagement specialist is what people think that the sector actually needs. But working together and truly collaborating means not being to trust each other, trust your funder, trust each other to do the work that we need to do, and that you know, specializes in your best strengths. And you know, I think also what I've seen tremendously throughout the region of Peel is that ability to, you know, work directly with funders, not being scared to actually, you know, put forth your suggestions, tell the rest of the community what you would like and where you sort of fit in the puzzle of the coordinated access or homelessness spectrum. And the region of Peel has been listening. They've been listening. And, you know, whether it's public health now overlapping with the homeless sector, we're seeing that collaboration really means about working together, but bringing what you best serve and best, you know, support your community with to the table. And for others to be able to either support that or be able to bring something else to the table.
Deepa, muted Jeff, any responses?
So in terms of the working with the survivors of violence, I want to say that the efforts that have been made with the help of United Way of Greater Toronto and those Wednesday morning meetings that I have been attending for nine weeks now, I can tell you that a lot of work that I have been doing in this last little while through this collaboration and other provincial and national collaborations, I could not have done that work. My clinic specializes in a particular area, but I do need support. This work never happens alone. The collaborations are needed. In terms of how structured can it be, can we avoid duplication? I think duplication is a discourse which has never been seen through, again, I'll use a metaphor of a lens, through a trauma-informed evaluation lens. Right. If you start looking at the duplication as the term that is used sometimes for our sector, through a trauma-informed evaluation lens, you would realize that everyone is doing something very unique and different. We actually rarely duplicate. We might cross paths, we might collaborate, we might try to create more safety and security for the populations that we work with, but we don't necessarily do the same thing. Each one of us have a very distinct role, and sometimes very smaller organizations which are working on a very grassroots level, their work actually establishes and creates the ground for us, an organization like mine, to come in and say, I will take the case and go to the federal court now, or I will do advocacy for the system change now. So I think each one of us have a role, and most definitely this has given us an opportunity to collaborate and understand each other's location a bit better and appreciate each other's role in this sector. But I don't necessarily believe that there is, this is the time to look at it from a lens of who is doing more or less. It's about who is doing what and how can we actually do this partnership more closely together.
Thank you. Webinars at uwgt.org. Keep the questions coming. Jeff, over to you on this duplication.
I was just going to say that, I was echoing the comments of my fellow panelists. I mean, I think we're going to see more service integration and more coordination, and more of that than streamlining organizations, because I know that 18 organizations right now, the 18 Indigenous organizations that are members of TASC, really struggle to support all of the 80,000 Indigenous people that are in the city of Toronto. We haven't gotten to the point yet where there's too much work and not enough people, right? And so, but I do think that this crisis has really intensified partnerships in ways that are allowing us to work better together, work more effectively together. And so I think we're seeing efficiencies through increased collaboration. I think that's going to be our pathway for the next little while, at least in the Indigenous sector. Yeah.
Thank you. One of the questions that's come in, couldn't agree more with Jeff on the need to look back for wisdom. Also know we should be looking forward for evidence in areas like AI and on the ground research. How do you think, and any of you can answer, how do you think we can continue to use evidence to make informed service decisions? Jeff, you want to start off?
Sure, yeah. I mean, I think there's a lot of fun. So we recently have discovered we need to document this, right? And so one of the things that we've done at Native Child and Family Services over the last year is start a new department. It's called our Quality Assurance and Decolonization Team. And the whole purpose of this is really to start gathering metrics and data and evidence, not only through community engagement, but to better understand what's going on. And I'm so happy that we developed that team over the last year, because now it's going to be really critical within the context of COVID to start looking at our metrics. And so within the context of social work, and there's we need to do this in all of our sectors, but a lot of our work has become virtual, right? Like 100% of social work 3 months ago was face-to-face, or maybe 90%, the vast majority of it, right? And now 60% of it is virtual. So I think that we have a lot of work to do. And I do think that there is a marrying that needs to happen between taking traditional Indigenous knowledge and taking some of the really good evidence-based Western science that we have and weaving them together in ways that continue to provide an evidence base for us to understand how we achieve better outcomes through COVID.
Thank you. Michelle, you talked at the beginning about the Peel Alliance to End Homelessness and how years ago you were already using research and data from people with lived experience to prioritize need. Have you seen this evolve? Where do you see it evolving to as we move forward?
Absolutely. I think one thing that we've learned is that essential to the goal of ending homelessness is to gather real-time person-specific information. And the Peel Alliance did do this by creating their by name list in the community. And you're seeing many communities, specifically in Ontario, but throughout Canada, want to be data informed, want to have that real specific data about individuals so that they know what the needs are out there. And real-time actionable data allows for triaging of service, systems performance evaluations, such as, homeless inflow and outflow, and also allows advocacy for specific policies and resources necessary to end homelessness, even in Peel. The Peel Alliance to End Homelessness, we also worked with the Canadian Alliance on a Built for Zero campaign. As such, we actually have achieved a quality by name list. You know, following development and testing of the by name list, the Peel Alliance to End Homelessness really does encourage all Peel service providers to be connected to serving the people that are experiencing homelessness and participate in the by name list and its usage.
I think also your most recent work around the shelters and your ability to use hotels and shelters and keep that number down will, I think, inform how we house people in the future and how we continue to track COVID in future phases as well. Deepa, I saw you wanting to jump in maybe with a comment around what this means around gender-based violence and the importance of data.
So yeah, I just wanted to say that the data and availability of it is also dependent on who is coming forward and who's able to tell the story or not, right? So
Correct.
so we talked about who is it impacting the most and what the stats are, current existing stats are on violence against women. The clinic works with survivors of sexual assault. We have been doing a system change project funded by United Way Greater Toronto around sexual harassment for precarious status women. And in all of those scenarios, we know that the data we have is very trauma-informed model data, but not necessarily the concrete number data that we would go after, because the cases don't come forward, the cases don't get reported. So I say that evidence needs to be, again, as we say that the services should be trauma-informed, the evidence should be trauma-informed too, because not everyone gets to tell their story. And women experiencing violence definitely are that biggest component, which gets falls through the crack when it comes to the numbers. So then if we have only 40% of women actually seeking help in normal circumstances, lesser percentage seeking help right now. So the issue is much more rooted in our communities, and we need to do way more work to actually even get the data that we need to give us a fair assessment of what is happening. We are only seeing a tip of an iceberg, and I just wanted to raise that as an important point.
It's so critical. It kind of dovetails to Jeff's comment about, yes, there's an importance for quantitative data, but we also have to get a sense of intuitively what's happening on the ground, because these are not, in any of the cases we're talking about, these are not individuals who are going to necessarily come and fill out a form or do something online that's giving you all the data. So it sounds smart and like the right thing to do, but when applied to those people that we're working with, often not as easy. This is a question that comes up each time, and it is pressing for so many gathered on this call because they care, they love this place we live in, they want to give back, and then they call or they reach out or they email and they can't volunteer. What opportunities are there, if any, in your respective organizations in the sector for people to volunteer in some shape or form? Anyone?
I can tell you that like the clinic depends on volunteer base hugely. I just had 2 new summer interns start with me, volunteer summer interns start with me alone. And we have like 12 who started with the whole team just last week. So we depend on our volunteer base quite a bit for not only the creation of the materials that we do or the resources that we have, but also to support day-to-day activities of the clinic. Right now, a lot of that volunteering is also going to be remote, so people will probably not have the same kind of experience as they would have had in normal circumstances, but the clinic is still seeking volunteers to help us out with various different projects, and they are from helping us in a intervention in a case to helping us create a public legal education material to create a video, all different kinds. In terms of the resources that are needed, I think I talked about it briefly at the beginning. I think in coming months, we would be needing more supply of those food vouchers for women. We will be needing more supply of the electronics, gadgets for women. There are lots of women with young children stuck with no access to laptops. And I think someone on the panel mentioned it. It's one thing to have access to resources and be able to connect. But if you have a young child and you don't have a phone, or you don't have a laptop, or you don't have a tablet, I don't know how you are staying connected. So I think all those resources in coming months will be needed more.
Jeff, Michelle, either of you on volunteer opportunities?
Sure, I can say real quick. I mean, obviously the context of COVID has complicated face-to-face volunteer engagements, and that's something that we have been thinking through. I think that as our process continues to be refined, and as we continue to support families, one of the things we're looking at is volunteer support for the delivery of contactless hampers, right? So we're now supporting families with everything they need for a week at a time. And we're basically producing these massive boxes that have food, education kits, supplies, medicine, and are creating systems by which those can be picked up contactless and then dropped off contactless for families. So we're looking at different options for folks to be able to provide support in those ways. Thanks.
Thank you. Michelle?
Well, you know, most definitely, if people can obviously donate to their local food bank, to their local shelter, that's always helpful. But I think what I'm seeing more than ever is the need to really advocate, and there's many various different campaigns out there. And by getting the federal government to invest in a COVID-19 recovery for all Canadians, which includes making investments, creating jobs, kickstarting our economy as well, joining one of the campaigns, contacting their MPs or senators across the country, you know, being able to continue on supporting each other, providing a platform or the ability to reach out to community members who you know are vulnerable and may you know, be at the cusp of homelessness. There's many things people can do from home, just reaching out to others or doing advocacy right from the very computer. Because I really do think that now more than ever, we're reminded that housing is a human right, and any community that leaves folks unhoused is really violating conventions and their social contract of what society really means. So, you know, get active, write your local MPs and your local officials about the issues that are really important to you.
Thank you for pushing us, provoking us upstream. 30-second go around for each of you. What gives you hope? 30 seconds. What is giving you hope in this moment? Deepa?
What gives me hope is that I have connected with way many more of my peers in the last 10 weeks than I ever did. And that gives me hope. I am truly, truly in this together with all of you. And that is the hope for me.
Doctor?
Similarly, I think what gives me hope is seeing the relentless work that's being done by my colleagues to check out frequently, to see what we can do to support each other, to support families, right? It's no longer, I have this budget in my agency for this amount of dollars to support this amount of families. It's, do you have enough over in your agency to support people? How can we do this work collectively, right? I think for me, it's, we have become a circle. We have rallied together as a strong, interconnected circle of agencies that are committed to doing whatever we need to get our families through this. And through that, we're not only going to achieve good outcomes for those children and families, but I do believe we're going to stumble upon critical interventions that are going to help us change things and modify systems moving forward. That might have been 40 seconds, sorry.
It was well worth it. Bring it home, Michelle, bring it home.
I'm really encouraged, and what gives me hope is that people are still fighting. In the homelessness sector, we're fighting to end homelessness in Canada. We know that, you know, modern mass homelessness as we see it today has not always been that way. It's really the product of policy choices made over the last 30 years. And I know that as we recover from the devastation of this global pandemic, we do have an opportunity to make better choices with targeted investments, with policy reform, to really eliminate homelessness and other marginalizations. And I really do feel it's incumbent upon all of us to ensure that we do not return to normal and that our national recovery enhances the lives of all Canadians.
Michelle, Deepa, Jeff, thank you for immersing us into the waters of your work now, meeting emergency needs, and then pushing us to start to imagine upstream what that might look like. And thanks to all of you donors, friends, frontliners who have taken an hour of your time to stop and listen. Let me tell you what gives me hope. As always, let me end with a note that I got from a senior who may be with us today. Let me read it to you. I live in a basement in Brampton. I joined your webinar on seniors last week. I'm a long retired professor, and I was very alone, the most I have been in my life. And I have been through wars and poverty and loss that few can imagine and words can't describe. I finally called a United Way agency. A staff came with some activities and food. Most, she brought me hello. Her twinkling eyes said she was smiling behind the mask. She said, I'm here to help, whatever you need. I said, can you come by every few days just to talk? Maybe help me join a group or a workshop or something. She invited me to join an online support group. Then I came to your webinar. At the end, you made everyone unmute, and suddenly names and smiling faces started flashing across the screen faster and faster. A man with a mustache in a lazy boy chair, a dog on a lady's lap. We sang together. For the first time in months, I laughed. I smiled. I imagined tomorrow, next week. Believe me, I haven't learned much in my 90+ years, but I know this: hope, imagination, always begins with people. Not the need you see, but getting to their deep need. Hope is always by people, for people, with people. At the end of your next webinar, can you unmute us again? And please, can you have us all cheer and clap for the frontline heroes at United Way agencies, like my new friends that come every few days to say hello. They now put a twinkle in my eyes behind the mask. IT, unmute these friends that we have in the webinar. Let us all clap and cheer and bring it home. Frontline staff.
Yeah. Great work. Great work.
Bravo!
Bravo!
Bravo.
Bravo!
Hello.
Hello, nice.
Bravo.
Hello, hello.
Bravo! Yay! Bravo! Yay.
Thank you.
Bravo!
Faces, people.
Thank
Let us
you.
see your beautiful faces.
Thank you. Awesome.
Bravo!
Look at
you
the
very
beautiful
much.
people.
Thank you so much.
Very much.
Bravo!
Yeah.
Bravo!
Thank you.
Thank
To
you.
all the frontline
Thank you.
staffers.
Okay, can you take this picture?
Excellent program. Yeah. Excellent program. Fantastic.
Oh no.
Yeah. Oh.
Trying to start the season with a replacement years ago.